Okay, let's dive right into this explainer. Look, if you've got a dental surgery on the calendar, you might be feeling that familiar flutter of nerves right about now. And honestly, that is totally normal. But today we're going to pull back the curtain on your upcoming appointment to show you exactly how rigorous clinical standards operate behind the scenes to keep you completely safe. By the time we wrap up, you'll see that your dental clinic is basically a highly regulated, state-of-the-art safety net designed from the ground up entirely around your comfort. We're going to break this whole process down into 5 quick steps: easing your dental anxiety, preparing for surgery day, arriving at the office, safety during your procedure, and finally, recovery and going home. All right, Section 1, easing your dental anxiety. So let's just address the elephant in the room right away. Being nervous about the dentist, it is incredibly common, and your feelings are 100% valid. Seriously, you are not alone here. The Journal of Dental Hygiene actually notes that between 50 and 80% of adults experience some level of dental anxiety. Just think about that. If you're walking down the street, literally more than half the people you pass share this exact same fear. But, modern dentistry has evolved so incredibly to address this. They use conscious sedation to transform what used to be a nerve-wracking ordeal into a completely peaceful, stress-free experience. And that stress-free experience? It's built on a massive foundation of strict care. As Dr. Paul Shadid from the American Dental Association points out, your well-being is the ultimate priority. The ADA, along with state quality assurance commissions, are constantly updating clinical guidelines. We're talking everything from fasting recommendations to weight-based dosing, just to make sure they align perfectly with super strict national hospital standards. You are in incredibly highly trained, heavily regulated hands. Moving right along to Section 2, preparing for surgery day. Building your confidence actually starts well before you even leave your house. Following these strict at-home steps guarantees your body is perfectly prepped for sedation. First up, you've got to stop eating and drinking for 6 full hours before your surgery. If you take daily medications, like say for blood pressure, your dentist will explicitly tell you which ones are approved to take with just a tiny sip of water. Oh, and this is absolutely crucial. You have to secure a responsible adult to drive you to the clinic, hang out during the procedure, and drive you home. If you show up without this escort, no joke, the clinic will actually cancel the surgery right then and there. It is all for your safety. You'll also get this sort of physical checklist to follow. And okay, some of these items might seem a little weird at first glance, like no makeup, no nail polish, wear loose short sleeves, but they exist entirely for the clinical monitoring equipment. Short sleeves mean the blood pressure cuff can fit perfectly on your bare arm. Taking off your nail polish, that ensures the pulse oximeter on your finger can accurately read your blood oxygen levels right through your nail bed. Basically, every single rule has a highly specific medical purpose. Next up, Section 3, arriving at the office. So you've arrived at the clinic. At this point, your clinical team conducts a really thorough, documented assessment. Honestly, this isn't just a quick, hello, how are you? They're going to check your baseline blood pressure and heart rate, calculate your body mass index, and assign you what's known as an ASA physical status grade, which is basically a fancy anesthesia safety metric. They'll also review your medical history one last time, just to make sure absolutely nothing has changed. They do all of this to tailor the sedation perfectly to your unique body and, of course, to secure your informed written consent. Now, if you're getting sedation, it's most likely going to be what's called conscious sedation. I know a lot of people get anxious about losing total control, but listen to this definition straight from the clinical guidelines. Conscious sedation just depresses your central nervous system enough to relax you, but you totally maintain verbal contact. You can still breathe completely on your own, your protective reflexes are totally intact, and you can easily respond to the team when they ask you to, say, turn your head or open a bit wider. When you compare the different levels of sedation, it really puts things into perspective and highlights the massive margin of safety you get with standard in-office dentistry. On one side, you've got minimal to moderate sedation. You're relaxed, maybe a little drowsy, but totally responsive. That is the standard for the dental chair. Compare that to deep sedation or general anesthesia on the other side, where a patient is unconscious and unresponsive. That usually requires a full hospital setting and a dedicated anesthesiologist. By using conscious sedation, your dentist keeps you safely away from the risks of being totally under, while still completely wiping out your anxiety. All right, Section 4, safety during your procedure. Okay, so now you're in the chair, you're feeling nice and relaxed. Let's pull back the curtain on the literal hospital-grade safety net surrounding you right now. Mandated by those strict quality assurance commissions we talked about earlier, all these machines are tracking your body's functions second by second. You'll be hooked up to a pulse oximeter for your heart rate and oxygen. You might have capnography tracking the carbon dioxide in literally every single breath you exhale. There's a blood pressure monitor, maybe even an EKG for your heart rhythm, depending on your health history. They even have backup oxygen delivery systems just standing by. The team is constantly translating all this complex data into real-time safety for you. And hey, it's not just about the fancy machinery. State regulations legally require that an appropriately trained team member, usually a dedicated sedation nurse or an assistant, must continuously monitor you and physically document your vitals every 5 minutes, without fail. Literally, from the moment the procedure kicks off to the very end, their number one job is just watching over you. And to give you even more peace of mind, you really should know what happens when there aren't patients in the clinic. These clinical teams don't just plan for safety, they actively practice it. Dental offices go through periodic inspections where the team has to run scenario-based training drills for super rare emergencies. We're talking sudden drops in blood pressure or respiratory spasms. They rehearse these responses like a highly trained emergency room pit crew. So, if the unexpected ever were to happen, the response is immediate, muscle memory practiced, and totally flawless. And finally, Section 5, Recovery and Going Home. Before you know it, the procedure is totally done. Now, as the sedation starts to wear off, it's pretty normal to feel a few temporary side effects. You might feel a little drowsy, maybe your mouth is dry, or you could get a tiny wave of mild nausea. But listen, you won't be left alone. You'll get to just chill out in a quiet, dedicated recovery area, and a clinical staff member will keep directly observing you and monitoring those vitals as your body clears out the medication. And when it actually comes time for your discharge, you are never, ever going to be rushed out the door. Your dentist has to make absolutely sure you pass strict, documented milestones before you get the green light to leave. Your vital signs have to be back to your normal baseline. Any pain or discomfort has to be addressed. If you had an IV, the cannula has to be safely removed. And finally, that responsible adult escort we keep mentioning, they have to be physically present to get your written post-op instructions and drive you safely home. So, when you look at the sheer volume of preparation, the incredibly advanced monitoring tech, and the super strict protocols guiding every single minute of your visit, it's pretty obvious that your safety is literally engineered into the very fabric of modern dentistry. Armed with the reality of all these incredible clinical safeguards, the unknown really isn't so scary anymore, is it? It's time to trade that anxiety for relief. So, are you ready to take that empowering next step and get the care you deserve?